the organ pancreas is a very important organ supporting the digestive system. Most of us are aware of the presence of stomach. When you have that feeling of hunger, we know the presence of the liver, the intestines, the gallbladder, but most of us are not aware that another important organ called pancreas is there in our body, and it has got a very important role to play in our digestion. Now this pancreas is a flat organ, yellowish in color, the size of a medium sized fish, and it's about 10 to 12 inches in length, and it is just situated behind the stomach. Between the back and the stomach is more towards the behind, and it's fairly well protected. It has got a broad area closer to the intestine called the head of the pancreas, and as the pancreas goes towards the left, it becomes thinner. It's called the tail of pancreas. And this pancreas has got a tubular structure in the center, from which actually this pancreas produces white liquid called pancreatic juice, and that will flow through this tube into the intestine. The juice called a pancreatic juice is full of enzymes which help in digestion, and normally the pancreas doesn't produce anything. It will only produce in response to the food we eat. So whenever we eat food, say about 4 or 5 times a day, the breakfast, the lunch, the dinner, the snacks, etc., when the food goes from the food pipe and the stomach into the small intestine, there is a stimulation of the pancreas, chemical stimulation, which will secrete this liquid into the intestine. This liquid will act on the food and will break down with the help of its enzymes into carbohydrates, fats and proteins, and this will facilitate this food to be absorbed into the small intestine. Another important function of this pancreas is endocrine function, and that is secretion of what is called insulin, which most of us know. Insulin has got a very important role in the glucose metabolism, that whenever our blood glucose level goes up, especially soon after a meal, after a sweet or any sweet drink, when the sugar goes up, automatically the pancreas will sense the sugar in the blood and releases one hormone called insulin, which is secreted by a group of cells called islets of Langerhans, which are located at the tail of the pancreas. This hormone, insulin, which will act on the sugar and will digest the sugar and reduces the sugar levels down. In other words, it will maintain a proper sugar balance so that we will not become hypoglycemic, that is, our sugar doesn't go down too much, or hyperglycemic, where the sugar will not go up very much. In addition, it will also help in storing this excess sugar we take in the liver in the form of what is called as glycogen. So this particular hormone, in addition to 20 other hormones, are produced by pancreas. So we understand that the organ pancreas got some very important role to play in our day-to-day health maintenance. The pancreas unfortunately gets afflicted by a few conditions, and these are called acute pancreatitis, chronic pancreatitis, and also pancreatic cancer. Acute pancreatitis is a condition just like acute appendicitis. When the appendix becomes swollen and red, pancreas also gets swollen and becomes red, and it will get damaged and it will likely to lose its function. When does this acute pancreatitis occur? It occurs essentially due to excess alcohol, smoking, and a few other conditions like cholesterol and so on. And these patients with acute pancreatitis present with severe unbearable abdominal pain radiating to the back, and that will require emergency medical consultation. The other condition is called chronic pancreatitis, where when pancreas gets repeatedly damaged again and again over a period of time, it is likely to become hard and will lose some of its function, and that's called chronic pancreatitis. And this condition can have stones in the pancreas. It's called pancreatic calculi, and they'll also have severe pain. The third most important condition is pancreatic cancer. pancreatic cancer is not uncommon in our country and is essentially seen in slightly elder individuals, and because of a tumor in the pancreas, it will block the passage of bile, because this bile duct which takes the bile from the liver in the intestine passes through the pancreas, and when this tumor blocks the bile duct, patients will present with jaundice, namely high colored urine, yellow eyes and itching. If any of these symptoms together present, it may indicate that there is something seriously going wrong with the pancreas and that need to be tested. Now, how do we diagnose this pancreatic diseases? Acute pancreatitis can easily be investigated and by a blood test called serum amylase and lipase, which can be done in about 10 minutes time, and that will tell us that the patient has an acute pancreatitis. And ultrasound for some reason is not a very good investigation for diseases of the pancreas. CT scan and MRI are two important investigations which will help us tell about the size of the pancreas and whether there is any disease in the pancreas. In addition to MRI, there is another investigation called MRCP, which will tell us the ductal status. In other words, whether the tube within the pancreatic duct, pancreas called the pancreatic duct, is the normal size or it's swollen, or there is some block like a stone blocking or a cancer blocking it. It will also tell us about the bile duct position as well. And the other investigation for pancreas is what is called as ERCP. This is done by a gastroenterologist. He passes an endoscope, which is a tube with a light at the tip, through the mouth into the intestine, and by passing a small fine tube into the pancreatic duct and injecting a medicine, we can take an X-ray and see the normal anatomy of the pancreas or abnormal anatomy of the pancreas, suggesting some disease process. Again, pancreatic diseases should be treated in specialized centers by specialists. There are very many methods of treatment available, which include medical, endoscopic, radiological and also surgical. And again, a majority of the pancreatic conditions are treatable and curable. So if anybody has any disease in relation to pancreas, they should see a specialist who will exercise his knowledge and expertise in this field and try help you out. Thank you.